are some of the behaviors which we again see on a very neurotypical developmental pathways as well. And these often reflect one most important aspect of emotional comfort or emotional security, and two, a behavioral aspect of communication, trying to get control of their environment that is happening. So with head banging, again, we often see that's one of the ways in which children get immediate attention. Most often, as caregivers, that's one thing, we don't want them to hurt themselves. And this is something which most children catch as a cue. And it tends to happen recurrently because it's a behavior that gets reinforced, leading to repetitiveness in certain scenarios. So, what is very important is to be consistent. First and most important, sometimes children have this head banging, but in a very, very careful manner. That means, in terms of head banging, we see two scenarios. One, where the child is quite well aware and tends to choose soft surfaces which do not cause a significant amount of injury, and also they're very, very cautious, and they often keep looking at the caregiver or the parent to see whether they're being watched. In such scenarios, we do tell the parents to try and not give attention, and that will reinforce to the child that this is not an appropriate way to communicate, and rather use techniques or strategies in which the child can communicate to their needs more appropriately. And we want this to fade away. On the other hand, sometimes we do see where children tend to have these impulsive head banging behaviors, which is quite dangerous. So in such situations, we always tell the parents to immediately attend to, not necessarily given, but first create a safety space for the child. So either hold them, restrict them, take them to an environment where it's much more safer, and help them to calm down if they want to cry, if they want to regulate, giving them that comfort space which has to be created. And once the child is away from that distraction zone, most often we see it gets better. It de-escalates. At this point, possibly the child can be engaged in a more meaningful conversation if it's an older child, or if it's a younger child, they can look into what are the aspects of what the child is looking for to begin with, what caused this behavior, that can be attended to in a more positive way. But most important is to not immediately give in to what the child is throwing the tantrum for or having the head banging for, because that will only create a unintentional attention, and the child will keep repeating to do the same thing.